The biological imperative. The mechanism of action. The most foundational truth is that massage is a physical intervention designed to manipulate soft tissues, muscle, fascia, tendons, ligaments, to elicit specific, measurable biological and neurological responses. This is the bedrock of the entire field, regardless of whether the focus is peak performance or injury care. The literature consistently articulates the following foundational mechanisms. A. Mechanical and physiological alteration of connective tissue. The primary irrefutable first principle is that sustained directed pressure and tension, whether via effleurage, petrissage, friction, or direct compression, physically alters the viscoelastic properties of soft tissue. The texts collectively acknowledge that tissues, especially fascia and muscle, are subject to thixotropy, the property of becoming less viscous when subjected to agitation. The mechanical stress applied by the therapist aims to disrupt, remodel. Adhesions. Overuse, trauma, and chronic poor posture lead to the formation of crosslinks or adhesions within muscle fibers and between fascial layers. These links restrict range of motion, ROM, and contribute to pain. The texts implicitly agree that deep specific friction and stripping strokes are employed to mechanically shear and stretch these fibers, encouraging a more organized, less restrictive structure. This is the common thread in books discussing deep tissue massage and myofascial massage, increase local tissue permeability and fluid dynamics, the transport system. Massage strokes, particularly rhythmic compression and decompression, act as a mechanical pump. The irreducible truth here is that waste products, metabolites, inflammatory mediators are mobilized, and fresh blood, oxygen, nutrients, is encouraged to enter the local area. This principle underpins the use of pre-event, inter-event, and post-event massage, as detailed in sports massage for peak performance and healing sports injuries. The improvement in venous and lymphatic return accelerates the removal of irritants and facilitates cellular repair, which is critical for recovery. B. The neurophysiological gait and reflexive response. The second biological truth transcends mere mechanics. Massage is a potent neurological intervention that modulates pain perception and muscle tone. The texts implicitly rely on the gait control theory of pain and the basic reflex arc mechanisms. Afferent modulation, the sensory overload principle. Manual pressure provides a flood of non-noxious sensory input, mechanoreception, that travels faster along the neural pathways than pain signals, nociception. This closes the gate in the spinal cord, reducing the brain's perception of pain. This principle explains the immediate analgesic effect across all applications, from the minor ache to the post-injury chronic pain, and is central to books like Massage for Pain Relief, Reflexive Tone Reduction, the Muscle Spindle Loop. Specific techniques, such as sustained pressure on trigger points, a concept central to many of the books, or slow, deep strokes, stimulate muscle spindle and Golgi, tendon organ GTO reflexes. The fundamental truth is that these proprioceptors, when adequately stimulated, signal the central nervous system to decrease the efferent, motor, drive to the muscle, resulting in a palpable, reflexive reduction in resting muscle tone and guarding. This mechanism is crucial for restoring length and function to taut muscles, making it a foundational concept for athletic massage and therapeutic massage in athletics. The systematic imperative. Application and context a significant portion of the literature, particularly the complete guide and comprehensive care texts, is dedicated to the systematic application of these biological principles, adapting the techniques to the athlete's specific needs, which change over time. The irreducible principle here is contextualization. Massage is not a monolithic treatment but a dynamic tool that must be phase-specific. A. The triphasic model of performance. The most pervasive structure in the sports massage literature is the division of care into distinct phases, each with a unique goal, pressure, and technique selection. This is the systematic imperative. Restorative recovery massage, post-event. The first principle here is reduction of secondary injury and acceleration of physiological normalization. Post-event massage, often discussed in sports massage for injury care and muscle reborn, focuses on general flushing strokes, Effleurage Petrissage, to clear metabolic waste, reduce post-exercise swelling, and prevent the rapid onset of excessive delayed-onset muscle soreness, DOMS. The depth is often lighter than corrective work, prioritizing lymphatic and circulatory flow over deep tissue remodeling. Maintenance as corrective massage, inter-event off-season. This is the heart of preventative care, the truth being that non-symptomatic restriction is a precursor to injury and a barrier to peak efficiency. Maintenance massage, a core theme in texts like Sports Performance Massage and Advanced Sports Massage Manual, utilizes deep targeted techniques, stripping, friction, trigger point therapy, to address chronic fascial and muscular restrictions, e.g., tight hip flexors in a runner or rotator cuff tension in a thrower, before they become acutely symptomatic injuries. This phase aims for maximum range of motion, optimal resting muscle length, and balanced posture. Pre-event, pre-activity massage. Preparation. The core principle is neurological and circulatory arousal without muscle relaxation. Pre-event work must be stimulating and brief, employing brisk superficial strokes and tapotement percussion to increase local blood flow, elevate tissue temperature, and promote neurological excitability, essentially waking up the muscle without decreasing its ability to fire quickly. The consensus is that deep, intense, or prolonged work is contraindicated immediately prior to performance, as it may paradoxically decrease muscle power and stability. B. Injury management and rehabilitation. The books centered on injury care and healing sports injuries share the foundational truth that massage is an integral, non-pharmacological adjunct to the injury rehabilitation process. The systematic application of massage in this context follows the principles of tissue healing. Acute phase, inflammation. The principle is minimal direct intervention. The focus is on treating compensatory structures, muscles that are spasming or tight to protect the injured area, and using very gentle work proximal to the injury to assist with edema reduction. Subacute, proliferation phase, repair. The principle shifts to controlled mechanical stress. As the tissue is laying down new collagen fibers, targeted friction techniques, e.g., cross-fiber friction, as described in texts on advanced remedial massage, are applied to encourage the new fibers to align themselves parallel to the lines of stress, preventing haphazard scarring that limits future function. Chronic charged remodeling phase, function. The principle is restoration of full functional length and strength. This phase utilizes the full spectrum of deep tissue and myofascial techniques to remodel the scar tissue and release remaining compensatory hypertonicity, preparing the athlete for a safe return to activity. The texts underscore that the massage therapist must understand the specific pathology, e.g., hamstring strain tendinopathy, to apply the appropriate depth and duration of force, a concept that elevates the practice beyond a simple back rub. The Irreducible Toolkit, techniques and methodological philosophy, across all the texts, from Massage for Dummies to Advanced Sports Massage Manual, a core set of manipulation techniques is consistently presented, adapted, and refined. The foundational truth here is that all massage techniques are mere variations on a handful of mechanical inputs, classified by the nature of force application and its intended effect. The philosophy is that the technique must match the tissue state and the performance goal. A. The four foundational mechanical inputs, the vocabulary of touch. The entire lexicon of massage is built upon these four primary mechanical manipulations. Regardless of the advanced name, e.g. myofascial release is an advanced form of sustained friction and stretching. Effleurage, the gliding warming input. The first principle of effleurage, found in the Complete Illustrated Guide to Massage and others, is to initiate and conclude the work, ensuring systemic and local assessment. It is a light, gliding stroke, typically centripetal, towards the heart, to aid venous return and lymph flow. Its functions are irreducible: to introduce touch to warm the superficial tissue, to distribute lubricant, and to allow the therapist to palpate the underlying tissue. a vital first step in diagnosis. Petrissage, the kneading, squeezing input. The principle of Petrissage is the mobilization of deep tissue and the accelerated removal of metabolites. This technique involves rhythmically lifting, squeezing, and kneading the muscle belly. By compressing and releasing, it acts as the pump, mentioned in the biological imperative, significantly increasing local circulation and separating fascial layers. It is the workhorse of restorative and maintenance massage. Friction, the deep shearing, remodeling input. The principle of friction is the mechanical restructuring of dense tissue and the stimulation of deep blood flow. Friction applies focused pressure perpendicular or parallel to the muscle fibers. Cross-fiber. Friction specifically addresses localized adhesions, scar tissue, and chronic tendon restrictions, tendinopathies. Its first principle is that controlled, deep shearing force stimulates a mild localized inflammatory response necessary to restart the healing cycle and encourage the laying down of properly aligned collagen fibers. This is the core of injury care books. Stripping, deep gliding. A slow, deep, sustained unidirectional pressure along the muscle fiber's length used to mechanically stretch and strip tension from the entire muscle belly. Tapotement, the percussive, arousing input. The principle of tapotement is to stimulate the nervous system and increase muscle tone. Techniques like hacking, cupping, and pounding are short, repetitive, and bracing. They are used almost exclusively in pre-event massage to neurologically awaken the muscles and increase local tone without the deep relaxation caused by petrissage or deep friction. B. The advanced techniques as philosophical refinements. The advanced techniques mentioned in the texts, e.g., myofascial release, neuromuscular techniques, trigger point therapy, are not new inputs but systematic, focused, and integrated applications of the four core inputs, refined by a specific philosophy. Trigger point therapy, the neurological focal point. The philosophical truth is that pain can originate from a highly irritable, localized spot within a taut band of muscle, and this pain often refers to distant, predictable sites. This technique focuses the compression input, static ischemic pressure, to these loci to exploit the reflexive tone reduction, as described in the biological imperative, forcing the local spasm to release and resetting the neural feedback loop. Myofascial, release, the connective tissue continuum. The philosophical truth is that the body is an interconnected web, the fascia, that must be treated as a continuous system, not as isolated muscles. This technique applies sustained, gentle stretching and shearing friction until a perceptible release is felt, a mechanical and neurological unwinding of the fascia to restore global movement patterns, which is critical for long-term corrective and maintenance work. Active and movement techniques, the integrated system. Techniques like stretching, PNF, muscle energy technique, MET, and active compression, seen in texts like Massage for Cyclists or Stretching and Hogushi Massage, operate on the principle of combining manual pressure with client-initiated movement. The irreducible truth is that optimal length and strength are restored when the tissue is manipulated while in motion, forcing the nervous system to accept the new range of motion as functional. This principle exploits reciprocal and autogenic inhibition reflexes to achieve greater length than passive stretching alone. C. The self-care and adjunctive imperative, the inclusion of titles like Massage Ball, the Self-Massage Essentials, and the Foam Roller Bible introduces a final critical principle. The efficacy of professional massage is fundamentally dependent upon the client's continuous, active self-care, maintenance of tone and ROM. The mechanical and neurological changes achieved in a 60-minute session are temporary unless the client actively reinforces them. Self-care tools allow the client to apply compression and stripping friction inputs, the same core inputs, to specific trouble spots identified by the therapist, thereby maintaining the gains and preventing rapid regression to pre-treatment restriction levels. Empowerment and awareness. The ultimate truth is that self-massage empowers the athlete to become a participant in their own performance and recovery, fostering a heightened sense of body awareness and enabling them to address tightness and potential injury flags immediately, rather than waiting for professional intervention. The Irreducible Toolkit, therefore, is not a list of recipes, but a demonstration that the discipline of sports massage is an intelligent application of a limited set of mechanical inputs chosen based on the tissue's physiological state and the ultimate, phase-specific performance goal. The sophistication lies not in the complexity of the stroke, but in the therapist's ability to precisely apply the right force and timing to elicit the desired biological response. The value proposition, the return on investment. The first principle of the professional context is the explicit and implicit value proposition articulated across the literature. Sports massage is a value-add service that minimizes risk, injury, and maximizes output, performance. Injury as economic loss. By dedicating entire texts to injury care and rehabilitation, the literature establishes the truth that time lost to injury is an economic and performance liability for the athlete or organization. Massage is positioned as a proactive intervention to mitigate this loss by maintaining optimal tissue quality, identifying imbalances early, and accelerating return to play. Performance optimization. Books focusing on peak performance and sports. Performance massage assert that the marginal gains achieved through improved tissue elasticity, increased range of motion, ROM, and neural priming are directly convertible into competitive advantages. The value lies in enhancing the body's kinetic chain efficiency. Diverse delivery methods. The wide range of prices and formats, from a $6.41 pre-owned sports massage to a $140 textbook of remedial massage, reflects the economic layering of the field. Accessible self-care information is low cost, foundational professional knowledge is mid-range, and specialized academic or professional texts are premium. The diversity of providers, eBay, Walmart, VitalSource, Abe Books, simply reflects the broad distributed demand for this value proposition. B. The career and boundary imperative, the professional foundation. Texts like Therapeutic Massage in Athletics and various complete guide series stress the principles necessary for the longevity and credibility of the practitioner. Scope of practice and ethical clarity. The literature enforces the boundary truth. The sports massage therapist is a soft tissue specialist, not a diagnostician or prescriber of medicine. The ethical imperative requires the therapist to know when a condition moves from muscle soreness or tension into a complex pathology requiring a medical referral. This ensures safety and maintains the integrity of the profession within the broader healthcare spectrum. Collaboration over isolation. The consistent mention of the therapist's role within an athlete's support team, coaches, physical therapists, physicians, establishes the principle of interdisciplinary function. Success is not achieved in a vacuum. The massage plan must align with the athlete's training schedule, dietary plan, as hinted by nearby nutrition titles, and rehabilitation protocols, ergonomics, and therapist longevity. Though often understated, the profession's economic sustainability depends on the therapist's physical health. Advanced texts implicitly teach proper body mechanics, how to apply deep force using body weight and leverage, rather than small muscle strength, to prevent the therapist from becoming the patient. This ensures career longevity, which is a key principle of the business of massage. The lingual and cultural imperative. Universality of touch. A final, subtle truth emerges from the inclusion of texts in various languages. Le massage sportif. French, el masaje deportivo, Spanish, and anatomía a masaje deportivo, Spanish. Universality of human anatomy. The foundational principle is that the human body's anatomy and physiological response to touch are universal. Regardless of the language used to describe the technique, effleurage, tapotement, hogushi, the mechanical action and its resulting biological imperative remain constant. Cultural validation, the presence of titles incorporating global techniques, e.g., The Complete Guide to Modern Massage, Step-by-Step Massage Basics and Techniques from Around the World, validates the core truth that manual therapy is a globally recognized, enduring method of human healing and performance enhancement. Concepts from Eastern, like shiatsu or hogushi elements, and Western, Swedish deep tissue traditions, are fused into the sports massage discipline, highlighting its roots in the ancient art of therapeutic touch. Final synthesis, the core and complete long-tail summary. The conglomerate of texts on sports massage does not represent a collection of distinct books, but a single, integrated curriculum built upon the following 5 unified, irreducible principles. The biological imperative. Massage is a neurophysiological and mechanical intervention that modulates pain perception and physically alters the viscoelastic properties of soft tissue to optimize circulation and reduce muscle tone. The systematic imperative. The practice is contextual and triphasic, demanding a precise choice of technique, depth, and duration based on the immediate goal. Stimulate pre-event, correct, maintain inter-event, or recover flush post-event. The holistic imperative. The practitioner must possess a functional mastery of anatomy and a professional commitment to interdisciplinary collaboration to address the whole athlete and maintain ethical boundaries. The Irreducible Toolkit. All techniques are variations of 4 core mechanical inputs, gliding, kneading, friction, percussion, whose advanced applications are simply focused strategies for exploiting specific neurological and structural reflexes. The professional imperative. Massage is a valued, global, and economic service that provides a verifiable return on investment by maximizing performance and minimizing the risk and cost of injury, requiring self-care advocacy for sustained client results.